More than ever, younger patients are seeing surgical intervention for early aging changes. Fillers and non-surgical treatments can produce modest results, but for more comprehensive and natural-looking treatments to correct jowling and sagging, a mini facelift is a wonderful option with a very quick recovery period.
The mini facelift is another procedure that's on the rise in plastic surgery. Comparing the mini lift to minimally invasive or non-invasive procedures, which all really do have significant limitations, the mini lift can have comparable or only slightly longer downtimes. A mini lift performed the way I do it, in which the deeper tissues are released and moved rather than just pulled with a suture, can produce subtle, natural results that are truly long-lasting and carry the same kind of downtime as more conventional mini lifts, which, in my opinion, give very temporary results. The reason for the increase in popularity in mini lifts is that more and more younger patients are starting to realize that getting fillers every 6 to 12 months doesn't really achieve the look that they want. In fact, their facial shape is changing. Their cheeks are getting bigger. Their face is getting puffier. What patients are starting to realize too is that fillers add up in terms of cost and cumulative downtime.
So more and more younger patients in their late 30s and 40s are coming to ask for many of the procedures that have a shorter recovery than a full facelift, and they can bring them back to a social situation even as early as 7 days after the procedure, where they feel comfortable with how they look and also more refreshed. These results are oftentimes more natural than the non-surgical options they were considering.
In my practice, the mini facelift involves a shorter recovery time than a traditional neck and facelift, because only the areas of tissue relaxation are fully dissected and released. The amount of tightening that's needed is not as dramatic as in a patient with more advanced aging changes. Considering that, I've had many patients that return to work a week after surgery, right after the sutures were removed.
The mini facelift is an elegant procedure, subtle, meaningful, and noticeable to my patients without others noticing that they have had a procedure done.
What I see after surgery is a shorter recovery period and a very, very early high satisfaction rate with the procedure. Patients feel they look refreshed and they look good without looking different. In the long run, my experience suggests that people do not feel the need for a secondary facelift procedure for many years because it was done right the first time.